Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those like lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
ABC Wednesdays.
Y'all complain all day. We want books. We want paper towels in the classroom. Bet you want raises too.
I'm still waiting on the paper towels.
Abbott Elementary returns with a new season.
We asked the district for more after-school programs. They gave us $50 for class pets instead.
Critics cheer. Abbott Elementary continues to be one of the funniest and most beloved shows on TV.
What y'all doing out there?
Taking bribes.
Proud of y'all.
Abbott Elementary, Wednesdays, 9:30, 8:30 Central on ABC and stream on Hulu.
Imagine what's possible when learning doesn't get in the way of life. At Capella University, our game-changing FlexPath learning format lets you set your own deadlines so you can learn at a time and pace that works for you. It's an education you can tailor to your schedule. That means you don't have to put your life on hold to pursue your professional goals. Instead, enjoy learning your way and earn your degree without missing a beat. A different future is closer than you think with Capella University. Learn more at capella.edu.
You see, your stupid minds. Stupid.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola vibes dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease. So I'm paging Dr. Steve. Dr. Steve.
From the world-famous Cardiff Electric Network studios in beautiful downtown OJ City, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal Tacie, my partner in all things. Hello, Tacie.
Hello.
This is a show for people who had never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine and visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Please check out stuff.drsteve.com, stuff.drsteve.com. Scroll down. You can see the Roadie robotic tuner, or you can go to Roadie, ROADIE.drsteve.com. and find it there. They have the Roadie Coach that'll teach somebody how to play a stringed instrument, or you can get the Roadie robotic tuner. It's getting ready to be time for buying gifts for the holidays. This is a perfect under $200 gift for someone who plays an instrument. Brian May from Queen said these bloody bastards came out with this with the end at the end of my career. So he loves it. So who am I to argue with Brian May, for God's sake? Check out Dr. Scott's website at simplyherbals.net. Check us out at patreon.com/weirdmedicine. Everything goes there first, and then including just the behind-the-scenes video stuff all goes to Patreon. Cameo.com/weirdmedicine. I'll say fluid to your mama. And that's it. All right, very good. Thank you very much. Don't forget Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. Also, check me out at Normal World. My female ejaculation video should be complete and ready to run in the next week or two. And it tells the truth about squirting and female ejaculation. And if you want to read about it and just see the answer, go to drsteve.com and go to the search section of the website and just ask for female ejaculation. You can read the whole thing there. I used to talk to Brian Redban, and we're going to talk to Joe Rogan about it a long time ago before Joe got so huge. So I'm too small potatoes for him now, but back in the day, I just didn't have an excuse to go to L.A. when he was first starting out, and he asked us several times to come.
Doesn't want you anymore?
No, he hadn't asked in a long time. He's too bad. I mean, he's got Trump and Kamala on his show. Why would he want me, So
to fill in the spots.
Anyway, well, if you want to talk about female ejaculation, we can do that because there's a lot of mythology about it, and I have the right answer. It's the answer backed up by science. That there is coital incontinence and there is female ejaculation. They're two different things, and some women do both, some do none, and some do one or the other, which is where all the confusion comes from. So, anyway, hey, Tace. Why is a woman like a pinky toe?
I don't know.
Well, number one, there's 3 reasons. They're cute. Number 2, they provide much-needed stability and balance. And number 3, you don't appreciate them till you bang them on the coffee table. Yay!
That's funny, Steve.
All right, very good. That's the joke for the day. So anyway, do you have any topics today?
Well, I have a couple, but I can't remember. It's been a while since we've done a show because of things.
Yeah,
and,
we'll talk about that in a minute.
I have a couple, but I can't remember if I've done common vaginal infections or not.
No, you have not.
All right. Okay, we can do that one.
It's Tacie's time of topics. A time for Tacie to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacie.
Well, hello, everybody.
Hello.
It is very hot in here, so forgive me. And I've also had 2 glasses of wine, so
Excellent.
Forgive me. Vaginal infections can be caused by bacteria, fungi, parasites, or viruses.
Correct.
Some of these things normally live in your vagina without causing any problems. But sometimes they can grow out of control, causing an infection in your vagina and vulva, the area surrounding your vagina. Things that can trigger this or increase your risk include being sexually active, especially if you've recently changed your partner. Using vaginal hygiene products like douches, soaps, bubble baths, deodorants, vaginal washes and wipes, taking antibiotics, sometimes contraception, including the IUD, having a health condition that affects your immune system like diabetes or HIV, or taking a long-time steroid medicine.
Yeah.
Okay.
So steroids, suppress some of the activity of the immune system, and so that can allow things to start to grow. We'll see people who take steroids get yeast infections in their mouth even. It's called thrush. So that can be a problem. And, the crazy thing is I think this is proof that our Creator has a sense of humor, because the bacteria that makes a healthy vaginal wall is the same bacteria that makes yogurt. And it's also the same yogurt, I found out, that makes Tabasco sauce. So, because they ferment pickles in lactobacillus.
Okay.
So But don't put Tabasco sauce in your vagina, but you can put plain yogurt in your vagina to try to populate the vaginal walls with good bacteria. We've had people do that before. One of the problems is you get something like bacterial vaginosis, which is a Gardnerella bacteria that sort of takes over, and you can treat it with antibiotics, but then sometimes the antibiotic will also kill some of the good bacteria. So it's always good to repopulate that area with good bacteria. And we don't recommend douching at all.
Yeah.
Yeah, douching is bad. It doesn't help, and if you have a weird odor down there, you should get that checked because it may just be an infection of some sort.
Yeah.
Fishy odor can be caused by bacterial vaginosis. We would diagnose that by getting fluid from the vagina, looking at it under the microscope and seeing if there are white blood cells that have bacteria all studded on them, just growing all over them, are called clue cells, and that's an indication of this bacterial vaginosis that we would, again, you can treat with an antibiotic, but you could try to treat it with a little yogurt and try to just shift the bacterial flora in the vagina a little bit to something more advantageous. But anyway.
Yeah, it seems like sometimes when you're doing things that you hope would help don't seem to help.
Sure. Well, it's like that patient I had a long time ago came in and said, "Well, doc, I'm galled," and he had an infection called erythrasma on his junk. And erythrasma is a bacteria, can't be treated with an antifungal, and when you diagnose it by looking at it under black light, and it glows a beautiful salmon pink, unlike jock itch, which doesn't glow at all. And this person was putting bleach on it, and he thought that it was doing something because it burns. Well, it must be doing something because it burns so bad. And it was like, no, you were just bleaching your skin. It doesn't do anything for the infection, although you would think it would. But anyway, go ahead.
Okay, so a vaginal infection isn't the same as a UTI or cystitis.
Correct.
A UTI affects your bladder or the tubes that carry urine out of your body. Your vagina is part of your reproductive system. This is separate from your bladder and urinary tract. Okay, types of vaginal infection. Bacterial vaginosis. This is the most common vaginal infection. It happens when bacteria that normally live in your vagina grow out of control.
Correct.
Okay, stop that. Chlamydia. This is the most common STI in the UK. It's caused by a type of bacterium.
In the UK? So you got this off a British website?
Must have. Common symptoms include increased discharge, bleeding between periods or after sex, and pain when you pee or during sex. No. Genital herpes. These are caused by the human papillomavirus and spread through sexual contact. The warts appear around your vulva, cervix, vagina, or anus. Genital warts. These are caused by the human papillomavirus and spread through sexual contact. The warts appear around your vulva, cervix, vagina, or anus. Gonorrhea.
See, that's the things that are coming
Would
out
you
of your
stop?
mouth, Chad.
An STI caused by bacteria, gonorrhea, can cause an increase in discharge and pain around your lower abdomen. It might hurt when you pee, and you may get bleeding between your periods. So a lot of this is telling me that if you're bleeding between your periods, maybe it's not. It's worth getting checked out.
Yeah. The first time, for sure. You can have spotting between periods, and you can have pain. You can have, ruptured cyst, or you can have, what's it called? Mittelschmerz, where you have pain between your periods, and it's when you ovulate, and then you can sometimes have vaginal bleeding from that as well. So if you don't know the cause of abnormal bleeding, whether it's from your rectum, vagina, your nose, or anywhere else, you should get it checked at least the first time until you know that it's something benign. Go ahead.
Okay. Thrush. This is a common fungal infection. It includes itching or soreness around your vulva and sometimes a thick, white vaginal discharge.
Do they call
a bit like cottage cheese.
Yes, it is. It looks like cottage cheese. That's one of the ways you can diagnose it. It's white and kind of clumpy. I've never heard it called thrush in the vagina, but maybe in the UK they do. We just call it a vaginal yeast infection. But...
Trichomoniasis.
I've seen this.
It's an STI caused by a parasite.
Yep.
If you have trichomoniasis, you may have a yellow-green, foul-smelling, and possibly frothy vaginal discharge.
It looks like nanner pudding.
Oh, good.
If you've ever been in the South and you've ever had banana pudding, that's what it looks like coming out of your vagina. And you look at it under the microscope and you go and you recoil because there are these things in there kicking around. They're bigger than one cell, they're not one-celled organisms. And they have legs and they kick around. It's disgusting.
Oh, nice.
Yeah.
It's possible to have more than one infection at a time.
Correct.
You can have vaginal symptoms such as itching without having an infection. It's also normal and healthy to have some discharge from your vagina. The amount and consistency of this discharge can change at different times. See your GP if you think you may have a vaginal infection. You can also book an appointment directly with they call it different, genitourinary medicine. Genitourinary.
Okay, spell it.
GENITOURINARY.
Genitourinary.
Genitourinary medicine or sexual health clinic.
Right.
If you think you have an STI.
Lovely. All right.
Okay, so they talk about treatments if you want to go over that.
I don't care.
I didn't think you would.
No,
but
that's fine.
I mean,
what treatment are they?
Antibiotics and viral medicines for genital herpes, creams, ointments, and solutions for genital warts, antifungal tablets for thrush.
Correct. Trichomonas, we treat it with, if I remember correctly, metronidazole. I have not treated that in a long time. The trick with metronidazole is you cannot drink with it. And what it does is it causes a reaction called the antabuse reaction, where if you drink alcohol, it will not be fully metabolized. It will metabolize part of the way to this intermediary molecule called acetaldehyde. And when you have a buildup of that, it'll make you sick, give you a headache, and make you just feel like crap. And they'll give people antabuse to keep them from drinking, because then when they drink, it's like the Ludovico technique. It makes them feel sick, so they have an aversion to it.
Yeah.
But if you're taking metronidazole, it can do the same thing, so you can't drink on that stuff.
Some people try using home remedies such as live natural probiotic yogurt and tea tree oil to ease symptoms of thrush, but there's no evidence to say whether these things can help. Tea tree oil and other essential oils may irritate your skin and actually make your symptoms worse.
Yeah, don't use tea tree oil
it's best
on
to
mucous
avoid
membrane.
These.
Right.
Yes. Prevention. Many condoms. Common vaginal infections are passed on through sexual contact with an infected partner. These include chlamydia, gonorrhea, trichomoniasis, genital warts, and herpes. Using a condom can provide good protection against many STDs. You should also have a test for these before having sex with someone new, and they should too.
There was a study that showed that eating 150 mLs of yogurt containing, the lactobacillus, it's got to be live culture, for 2 months reduced bacterial vaginosis episodes by 60%.
But who wants to wait 2 months?
Right, I get it. But if you have chronic bacterial vaginosis, then if you would be happy to reduce your incidence by 60%. So if you're going to instill it into the vagina, use a vaginal applicator like a monostat applicator, and use plain cultured yogurt. Make sure it's got live cultures and it's plain. You don't want to be putting strawberry yogurt in your vagina. And you can just then suck it up into that applicator like you would monostat, and then bloop it into the vagina and hold it there as long as you can. And it will seep out, so be prepared for that. So either do this at night at home, or, you're going to have to wear a pad or something. But I've had a lot of people, when I was in primary care primarily, lots of people who swear that they were cured with that rather than taking the antibiotics. I would give them a choice. Bacterial vaginosis is just, it's a lifestyle thing. It's not threatening. So if they wanted to try the yogurt first and then it went away, then fine. If it didn't, then we could try the antibiotics.
I also have a very scientific article sent to us by Tacie DeLoach.
Okay.
It's maybe a little too much. It's called Brain Goop That Traps Hunger Neurons Drives Obesity.
How stupid.
Okay, we don't have to do
Now,
it.
what is it?
I mean, it's very technical.
wow, that is very interesting. Please tell me more.
It's time to go to the bathroom, everyone.
What?
If you want me to do it, it would be a good time for people to go to the bathroom.
I see. Okay, I got it. Well, just give us the Reader's Digest version.
Well, there really isn't.
Okay. Well, why don't we...
it's so technical. It's almost like it's okay.
Yeah, well, what we'll do is we'll feed it into the AI and say, summarize this for, a freshman college crowd, and usually that does pretty good. And then it'll summarize it for you.
Okay.
All right, good. Well, thank you. Anything else?
Nope.
All right, good deal. You want to answer some questions?
Sure.
Number one thing, don't take advice from some asshole on the radio.
Yeah, thank you, Ronnie B. Couldn't agree more. All right.
Good morning, folks. I hope everything's getting somewhat back to normal up in East Tennessee.
Well, we'll talk about that in a minute.
Got a little bit of a rudimentary question for you. What does pH stand for? I've heard of pH. I know it's interaction with things, but I don't know what pH actually stands for.
Yeah.
What's a couple of other, BP, blood pressure, that one's easy.
Yep.
But initials that you hear that us poor old stupid laymen don't know what that really means. Bye.
Yeah, thanks, man. Well, pH stands for potential of hydrogen. And what it indicates is, it's a measure of acidity. And it is a logarithmic scale, so a change of 1 point, so like going from 7 to 6, means a 10-fold increase in hydrogen ions. And you can do some math with it. You can do some stuff. So, neutral is a pH of 7. Things that are really, really basic will have a pH of 14. And things that are really, really acidic will have a pH close to 0, and then everything is in between. So stomach acid has a pH of what, Tace, usually?
I don't know.
Yes, you
I don't remember.
do.
It's been forever.
Okay, well, it's like 3 or 4. And that is one of our protective mechanisms, too, is having a highly acidic stomach. The problem is it causes acid reflux and ulcers and those kinds of things. And when you take medications to increase the pH, in other words, decrease the acidity of the stomach, you allow more bacteria to get into your intestine than you normally would because they're not being killed by the stomach as efficiently. And those are people that end up with a thing called SIBO, which is small intestine bacterial overgrowth syndrome, where the bacteria from your food and things like that and your environment make it through the stomach into the small intestine, which should be relatively sterile, and cause a slime layer inside the small intestine. When you have that, you can have what we call postprandial distress, or symptoms after you eat. Post meaning after, prandial meaning eating. And those people will have bloating, diarrhea, abdominal pain after they eat. And that's actually pretty treatable. But as long as you continue to take things like pantoprazole or Prevacid or those kinds of things and keep your stomach pH up, it's prone to recur because the conditions that caused it in the first place, which is the stomach not acting as the complete defense that it could be, are still there. So your body requires a slightly basic pH at 7.4, and it's very tightly held. So if someone comes in with a pH of 7.5 or 7.6, we know that they are alkalotic, and it could be from respiratory alkalosis. In other words, they're retaining carbon dioxide like COPDers do, or they may have metabolic alkalosis because they're, for whatever reason, peeing out or crapping out acid, and so their body ends up being slightly basic. You can drink acid, acidic things, and for a very short period of time, you may transiently decrease your pH by maybe 1/10 of a point, but then it will rapidly come back to normal because the body really likes to maintain that pH at that 7.4 without varying. And if someone comes in with a pH of 7.1, something is really wrong. I think the lowest pH I ever saw in a person that was still alive was 6.8. And that was a person with severe diabetic ketoacidosis. That's where, and a lot of times that's how type 1 diabetics are discovered. They come in and they feel like shit, and they may even be pre-comatose, and they're peeing like crazy, they're thirsty, and you check their blood sugar at 700, and their pH is 7.2 or something, and that is a medical emergency. Back in the day, and I mean, in Henry VIII's time and up until, maybe, 100 years ago, people who had that would die. And now we have the means of treating that with using insulin and fluids, and lots of fluids. These people are all dehydrated. They're contracted. You dump a lot of fluids in. You get an insulin drip going. And then when their blood sugar gets back to normal, well, the weird thing is you don't cut down the insulin. You keep it going. You add glucose to the fluids, because if you stop the insulin too quickly, even though their blood sugar is normal, it'll go right back into ketoacidosis. So it seems weird. Why would you add glucose? Well, now you're allowing the body to start working normally again. And so you give them glucose in their fluids and insulin in their drip, and then you run both of those things up and down until you get them normal, and you keep them that way for a day. And then you can start thinking about switching them over to a regular insulin regimen. Remember, type 1 diabetics are people that are no longer producing insulin. All right?
All right.
All right, very good. So that's pH, and there you go. So thank you, Tacie Deloach. That's an excellent question. Very basic science question.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
So, you want to be a marketer. It's easy. You just have to score a ton of leads and figure out a way to turn them all into customers. Plus, manage a dozen channels, write a million blogs, and launch 100 campaigns all at once. When that's done, simply make your socials go viral and bring in record profits. No sweat. Okay, fine. It's a lot of sweat. But with HubSpot's AI-powered marketing tools, launching benchmark-breaking campaigns is easier than ever. Get started at HubSpot.com/marketers.
Fever, cough, congestion. When the symptoms keep coming, but you've got to keep going, you can rely on Mucinex Fast Max All-in-One. Just one dose of Mucinex Fast Max All-in-One relieves up to 9 cold and flu symptoms, helping you get on with your day. Need cold and flu relief? Get Mucinex Fast Max All-in-One and Done Relief. It's comeback season. Use as directed.
Feel your max with Brooks Running and the all-new Ghost Max 2. They're the shoes you deserve, designed to streamline your stride and help protect your body. Treat yourself to feel-good landings on an ultra-high stack of super comfy nitrogen-infused cushion that takes the edge off every step, every day. The Brooks Ghost Max 2. You know, technically, they're a form of self-care. Brooks, let's run there. Head to brooksrunning.com to learn more.
Oh, it's such a clutch off-season pickup, Dave.
I was worried we'd bring back the same team.
I meant those blackout motorized shades.
Blinds.com made it crazy affordable to replace our old blinds.
Hard to install?
No, it's easy. I installed these and then got some for my mom. She talked to a design consultant for free and scheduled a professional measure and install.
Hall of Fame son.
They're the #1 online retailer of custom window coverings in the world.
Blinds.com is the GOAT.
Shop Blinds.com right now and get up to 40% off select styles. Rules and restrictions may apply.
Let's do this one because it's come up already. And
Hi, Dr. Steve and company. This isn't a medical question, but I know that you all are located in East Tennessee, and I think a lot of other listeners are curious how you all are doing after the hurricane passed through the area.
Yeah.
I know there's been a lot of flooding and damage. I hope you all are safe. Just like to know an update.
Yeah, thanks, man.
Love the show, and
Thank
hope
you,
all
man.
are well and dry, and let us know what the report is from there.
Yeah, thanks. So, we should talk about this. Where we are, first off, we were fine. We didn't lose electricity. We never lost internet. It rained like crazy, and there was a lot of water around. But
a lot of wind.
A lot of wind. Now, just south of us, 2 towns south of us, it's not there anymore, basically. And we had... I have a friend who is the spouse of one of my partners, and I don't want to say a whole lot, but who ended up on the roof of the building of the hospital because the hospital flooded so quickly that it went from a couple of inches of water on the floor of the hospital to completely inundated. In other words, they were on the roof and the water was at the level of the roof, and they had to get a helicopter to get them off.
They were carrying 600-pound patients up the stairs.
Yeah, and had some of them in boats.
Yeah.
And floating them up. And it was nightmarish. I don't know about the 600-pound business, but it was a nightmare. A lot of people who were there have PTSD. There are a lot of people who still have not been found. Maybe in the hundreds of people. There are towns that don't exist, and these are mountain towns. You would think that in the mountains the water would just kind of fall off the mountain and you would never have flooding.
They had
but
no
it's not
warning,
true. Right? And there was no warning. The thing about this one was. We've heard this all before. We've heard it hundreds of times. We're going to have a bad, a lot of rain from this hurricane that's coming in, and we're inland. So why would we ever worry about a hurricane? But it dumped so much water, and then we had a dam break that was just south of us, and that water flowed north, and that was a nightmare, and that really contributed to a lot of this. And the rivers that we fish in and play in and all this stuff tried to basically kill us that day. Yeah. So we it's bugged us because these are our brothers and sisters down there. Plus, we have a little bit of survivor's guilt too, and the recovery efforts are still going on. And it's really traumatized this whole part of the country. So upper East Tennessee, northwest, northwest North Carolina, Asheville area, Weaverville, all those areas. I mean, it was a nightmare. Now, my brother lives in the mountains of North Carolina where I grew up, and they were fine where they were. They just had a lot of wind and stuff, but
I saw
it was just unexpected. Nobody expected this
on Facebook, where a lot of people were getting the text that said "seek higher ground." Week after the hurricane actually happened, because they had already lost cell power.
Right. Oh, and that's the other thing. Thank you for bringing that up. Is that I never want to hear anybody make fun of me about my ham radio hobby ever again, because. Ham radio was the only thing, and still is in some places, the only thing where communication was happening. Health and welfare, just, hey, I'm okay. I just can't get out of here because there's no roads. They've all been washed out. So one hospital was inundated. We had 2 others that were closed for that period. And, you got patients in there. What are you supposed to do?
I mean, multiple towns are gone.
Yeah.
Multiple.
Yeah. So it's bad. It's still bad. I'm not going to get into the politics of it. I'm going to let other people do that. But there's a lot of, there are some conspiracy talk going around. And then there's also some real, people with real experiences where, the Civil Air people, some of them said that they were grounded, trying to get supplies into people by, certain groups and stuff like that. So I don't want to get into all of that because I don't know the truth of it. We're not there experiencing that on the ground, but the truth will eventually come out. But it's too late for a lot of people.
Yeah. But it's just literally minutes away.
Yeah. Harrowing. The stories that we've heard from the people that survived, absolutely harrowing. And the stories of the people that didn't make it are just tragic. People trying to get out of there and just got swept away. And that was the end of that. And again, nobody expected this. I mean, yes, there are warnings. How many times have we had warnings?
But not like this. I mean, this was an actual hurricane where we live.
Yeah, right. Which we've
never had.
Right. No, it's one in 100 years.
Yeah.
And we hear about this. We get these warnings all the time. Oh, there's going to be flash flooding, and it never happens.
Never.
And so people were just kind of blasé about it. Well, here we go. It's another bunch of shit that we're being told by the weather, by NOAA. And this time they were right. And, the thing, I remember, I think when I was a kid, it was probably me, but somebody, well, I'm not lying this time. Yeah. And if you tell, it's like Tacie's mom. A lot of this stuff out of her, even if it's just 10% out of her mouth is bullshit, you can't trust anything that she says. We taught our kids, if you lie once, then we're always going to wonder if you're lying this time. So just don't lie. And when the weather gets all wound up because they love it, I've seen it before where there were tornado watches, and they get on there and they're doing their round-the-clock coverage, and they love it. You can tell how excited they are.
We've had some bad storms.
Yes, but I'm just saying, we've been told this, and
but not a hurricane. Never.
Right.
Never.
So everybody just ignored it for the most part until it was too late.
I mean, I drove to a town to have a birthday party.
Yeah.
Because it was sunny where we were.
Right. Until it wasn't. And
then 20 miles away, it was devastation.
Right.
A complete devastation.
So, anyway, so we're okay, but the area is not out of the woods.
No.
By any means.
Mm-mm.
It's going to be a long time. It swept the interstate away.
Yeah.
I mean, how do you sweep away a whole interstate? I mean,
whole interstate.
Big chunk of it. Now they've got detours, so we can go around now, but
There's
Lord.
no place to go to.
Right. Right. Yep. So anyway, that was incredible to me. Just seeing an area that I've driven through hundreds of times.
Yeah.
Under 20, 30 feet of water, maybe higher than that. And then wondering what's going on underneath there and then seeing it. And it's like, oh my God, once the water receded and then the interstate's just not there. Bridges aren't there.
Gone.
There's a town west of us that for a while didn't have any. It's surrounded by rivers and stuff, and all of the bridges were gone. So they were having to drive hours to get to places that normally used to take them.
That's why we're ATV people.
Yeah, that's right. People wonder about that.
Yeah.
Them Southerners and their ATVs. Well, don't laugh about that either. But no more bullshit about my ham radio. It was literally, and I've said this before, when nothing else works, when the cell towers don't work and you don't have satellite, you don't have Starlink. They did bring Starlink in, which was great. And we appreciate, the Starlink people very much for that. But you don't have Starlink set up yet. You don't have cell phones. All the telephone, your landlines are down, power's out. Ham radio is where it's at because it still works.
But the saddest thing is how people are helping.
Yep. Yep. No, I know. It's we're still very emotional about this because these are our brothers and sisters close by. But yeah, people are helping. Were you going to?
Well, I mean, I don't want to cry on the radio.
That's okay. It's all right. We've cried before on this radio.
But, I belong to a St. Pete site, and when they got hit by it too, and then Milton right after.
Yeah.
They're like, fuck you, don't come.
Right. They were like, fuck, tourists, stay away.
Yeah, and then our place is like,
please come and help us. Yeah. Yeah. So you hear a lot of stuff about FEMA and TEMA and all that stuff. Like I said, I don't have my own boots on the ground, but the truth will eventually come out about whether there were delays in helping us because of politics. That's what some people think. I don't know. I don't know if that's true or not. I think that for the longest time, the extent of the devastation wasn't widely known.
No, because you couldn't get there.
Right. Right. When communications are completely wiped out, it's hard for people to know what's going on unless you get up in the air and look at it, which you couldn't do until this thing was completely done. So it was, anyway, it was bad. So I used to be over a certain number of hospitals, and now I'm over one less, which is also tragic. Thank God all of those people, survived.
Yeah, because I don't think they thought they would.
No, and they're still traumatized by it. So anyway, yes, thank you for your thoughts and prayers. And as far as we are concerned, Dr. Scott and Tacie and I and BM John and all the other people that everybody's fine. But we're still, you can't be that close to something like this. And it's not like, oh, me too. But you can't be that close to something like this of people that you care about and not be affected by it. So, all right. Let's talk about something more fun. How about a testicle nightmare?
Okay.
Hey, Dr. Steve, this is Rob again.
Hey, Rob.
Wrote to you about having my testicles replaced and then having one replaced after infection.
Yes.
With the wrong size.
Yeah.
Anyway.
Yeah. So when you have a testicle removed for whatever reason, they can put prosthetics in there so you don't just have an empty sac between your legs because it feels weird and it looks weird. And if you're having intercourse with somebody, it's like, well, where are your nuts, right? So they can put these prosthetics in.
You think girls care about that?
Do you not?
No.
Really? So if you
wouldn't.
So if you were blowing some guy and then you just felt down there and there was just an empty scrotum, you wouldn't.
I really don't think I would care.
Okay. All right. Good. Well, guys think that you care, so I guess that's why. But anyway.
The update. I had to go eventually to the emergency room because I developed such a big infection, really about 4 inches above my left nut. And they had to cut it open and clean it and pack it. And I had to, change the dressing every day. It was a pain in the ass. Anywho, the doctor, the urologist who I saw in the emergency room, said not to put any more foreign objects in my body. I'm assuming he wasn't talking about my ass, but that's neither here nor there.
Right.
So anywho, what's your thoughts?
He might have had a better way to say that, but
I don't like really walking around with one nut.
Yeah.
You put your hands down your pants, you kind of like to feel two down there.
Yeah.
Should I give it a year or two and, see how it goes? Or do you think I should just never have another implant put in?
The reason that they said that is if they put another foreign body in there while there's still bacteria anywhere within 1,000 miles of your scrotum, it's just going to colonize it again, and you'll be in the same place that you were. So that's why they're recommending that. It's very difficult to eradicate an infection around a foreign body because it's not living. And so the white blood cells and all the antibodies and all that stuff just can't make it to it. So if you have an infected foreign body, it's got to be removed. And then, but I would wait until everything is healed up. All of this has completely resolved and there's no sign of infection. I would even probably do a C-reactive protein on you, which is an indicator of inflammation, just to make sure. I would repeat cultures and all that stuff, make sure it's all gone. and you've lived with it for a year or two, and then you can talk to the urologist about maybe putting one back in, because the ER doctor really didn't have any business, and they don't have any standing when it comes to urologic implants like that. So, I mean, they just literally have no standing. They're doctors and they know some stuff, but that's not their call. It would be the urologist's call. So talk to them, whoever put the implant in. And, if that person was part of the problem, maybe get somebody else to do it. But these things happen. It has nothing to do with the actual urologist that did your procedure. It was just one of those things. I used to tell people when I did Botox, even if you have Dr. 90210 doing your Botox, 1 in 200 people get a droopy eyelid. And I think, and that worked out. I did, how many of those did we do? We had one droopy eyelid the whole time.
Droopy eyelid.
Yeah, it happens sometimes. But post-operative infections happen at a certain rate. It's a very low percentage, but they do happen. And so it's probably no flies whatsoever on the person. Their technique could have been perfect, and there were just some bacteria hanging around from whatever, maybe from your prostate. Always blame the patient, by the way, or something like that, and it just happened. So give it some time, let it completely resolve, then give it some even more time, and then go see the urologist and
You
talk
can
to
also
him.
get Spock eye from Botox.
You can get Spock eye.
Yeah, where your eyebrow
true.
goes up like Spock.
That is correct, and some people like that.
And that's not, well, I had it once, and I thought that was my normal thing, and my doctor said, no, that shouldn't be like that.
We'll do a brow lift on some people.
They fixed it, and I've always gotten a brow lift, but the Spock eye it looked
Too
just
much.
like Spock.
Yeah. Now, your mother, I'm sure she wouldn't mind, she had an enlarged, or what's the word I'm looking for? An overabundance of eyelid on the top, and I would give her a brow lift, and it would lift it up enough so that she could see without having to have surgery on her eyelid.
Which she eventually had.
Which she eventually had to do because I stopped doing
turned
Botox.
out very
on her.
well.
Yeah, she did good. Yep. All right. Okay. It's called blepharoplasty, by the way, when you have
And insurance will cover it.
Correct. Yeah, it's one of the few insurances, or one of the few cosmetic procedures that insurance will cover because it actually affects your function.
Yeah.
Do you want to talk about your nose at all?
I mean, I can talk about that. Yeah. I mean, I had, what do you call it?
Concha bullosa.
A concha bullosa, which is like tumor, kind of like a benign tumor.
Severe deviated septum, and then it grows around and causes all kinds of
then
problems.
I walked into the doctor's office, and I looked at this. The doctor was looking at his computer, and it looked like a patient had a note in their nose was like a train wreck,
right,
with a big bulb next to it. And I thought, gosh,
that person's a mess.
Yeah, well, turns out that was me.
Yep.
And so he said, you've got a deviated septum. Well, I know everybody says they get nose jobs. Oh, I got a deviated septum, in quotation marks. But
right.
I really did have one with this concha bullosa, and it was causing my eyes to close, and my face always looked really swollen, and I just looked a mess. And he took it all out, and I asked him just casually, how much would it be if you fixed the knot on my nose? And he was like, oh, I'll do that for free.
Yeah, you had your dad's nose.
I did get a free nose job out of my actual deviated septum and concha bullosa.
Right. Yeah, because while he was there, he had to open it all up anyway.
Yeah, so he just fixed it.
So he just
and he got very excited about it. When I asked him that, he was like, "Ooh, we can do this and we can do that." And I thought, well, hell, if you want to do it, buddy, go ahead.
Yeah.
And he did it. And I can actually listen. If you've got a deviated septum and you're afraid to get that surgery, I can't tell you how wonderful it is
to be able to breathe.
Actually be able to breathe, because I did not know I wasn't breathing before. And I was breathing through my mouth all the time like a dang I don't know
mouth breather.
Mouth breather, yeah. And
well, I diagnosed Carl from WATP with a deviated septum. The first time I ever met him, I said, I'm pretty sure you have a deviated septum. He said, no, I do. How did you know? And I said, I could tell by just listening to you talk. Because he would say, he'd say kabod instead of come on.
Yeah.
There's an obstruction in his nose. And, every once in a while you can diagnose these things. We diagnosed a TV guy with acromegaly once.
What was that?
Acromegaly is a tumor that produces growth hormone, and when it does it in adult males particularly, they get huge joints. They'll get a big lantern jaw. And they used to say Richard Keel, the guy who played Jaws, might have acromegaly. I don't know if he really did or not, but that's the kind of thing that you look for. That's sort of facial thing. They sweat more, and the growth hormone.
Well, I sweat more. Maybe I have that.
No, you don't have it, but it's what it's trying to do is make your bones grow when you're a kid, when there's cartilage between them. When there's no growth plates anymore, it just piles bone on bone on bone, so it's not good for you.
Oh, okay.
So, and then the other, not too long ago, and she talked about this on the show on Normal World. Dave's producer and co-host, her name's Angela. We were working on one of my bits, and she asked me a question, and I diagnosed her with Ehlers-Danlos syndrome, type 1. She's got the minimum thing, but she's got hypermobile joints and elastic skin and stuff. So some things you can diagnose remotely.
Yeah.
You know what you can't diagnose easily remotely for me is rashes. People send me pictures of rashes.
Yeah.
And it's like, well,
no.
It could be this, it could be that. It's really hard for me to do it. The dermatologist, in their training, they look at slide after slide after slide of pictures of rashes, and they can just whip them off just like that. But it was very difficult for me to do that.
Yeah, I bet.
But anyway, all right. Very good. Thank you. Let's do this one.
Hey, Dr. Steve. It's your old pal, Diesel Child.
Hey,
from
Diesel
the
Child.
Fluid family.
Thank you, my friend.
Hey, everybody in the studio. How y'all doing?
Hey, we're doing good, man. How are you?
Well, that's lovely. Glad to hear that. I'm doing well myself, thanks.
Good, man.
So, discovered something. I'm now on a drug called pantoprazole.
Yes.
Which I'm now on because of...
You can call it that. It's also pantoprazole. It's a proton pump inhibitor for acid reflux.
I had my complete fundoplication.
Yes. Okay, so fundoplication, for people who don't know, is where they seal off the lower esophageal sphincter of the esophagus so that acid can't get up into the esophagus anymore. There's various ways that you can do it. A lot of times they just take stomach tissue and wrap it around and then stitch it in just to create a more narrow sphincter down there, so it's harder for stomach acid to get up into the esophagus.
My stomach on my hiatal hernia, which almost killed me twice from internal bleeding.
Oof. Sorry,
and
man.
What we found out was taking that medicine in the morning, along with my levothyroxine for my hypothyroidism.
Oh, yay! That's fun.
This is why I wanted to play this, because this may be apropos to you, Tace.
That ended up blocking sort of the effectiveness and absorption rate of the levothyroxine.
Correct.
Which threw off my thyroid.
Give thyself a bell.
So the doctor that I was dealing with was just increasing my thyroid medication to the point where it was so high that other doctors were like, hey, buddy, pump the brakes. This is a little high.
Does this sound familiar to you?
And I had a second opinion given to me, and that guy said, hey, you should probably take the thyroid medication in the morning.
Yes.
You can take the pantoprazole, or however you pronounce it, at night, and then you wouldn't have this interaction.
Correct.
Yes.
That's what I do.
That's what I do.
Okay, so you do. So, taking the levothyroxine, which is Synthroid, thyroid replacement hormone.
And then you have to wait. You have to wait 20 to 30 minutes after you take it.
So you knew that.
Or it will not work.
Right. Okay. Yeah. It interferes with absorption of levothyroxine when you take pantoprazole with it. and reduces its effectiveness. And so he's exactly right. What happens, they keep increasing your dose and increasing and increasing. And then if you stop the pantoprazole, now you're overdosed on Synthroid, and now you get hyperthyroidism.
Yeah, which is just as bad as low hypothyroidism.
We see this sometimes in people, not this particularly, but people who go to the pain doctor and they say, oh, my pain's out of control, it's out of control, and they keep increasing their pain medication. Turns out they're actually giving it to their son or they're selling it or whatever, they're not taking it. And then they end up in the hospital and you give them what
they're supposed to be taking,
quote unquote, supposed to be taking, and you overdose them. That's how you diagnose that, because you know immediately what happened was you gave them the dose that they've supposedly been taking for years. Now they're overdosed. Nothing else is going on. They haven't been taking their medicine. So you have to have what we call a come to Jesus talk with them.
I would say.
Just curious what you think of that.
Yeah, well, that's what I think about it. So anyway, Now, are there other PPIs that do this too? Is it just pantoprazole?
I do not know.
Okay.
That was never once in 25 years was it discussed with me.
Really?
Never.
Well, let's look up lansoprazole, and we'll just take a second. Like I said, Carl loves it when I look up stuff on the air. But lansoprazole and Synthroid.
I would say it's a pH issue.
I would think, okay, could be a pH issue or just a class-specific thing. Yep, same. Taking levothyroxine with lansoprazole interferes with the absorption of levothyroxine. Yeah, I wonder what the mechanism is. It might be that it's just a pH thing rather than a drug-drug interaction.
Yeah.
But anyway, all right. We've got time for maybe one more here. Let's see here. Let's do a poop one. How about that? Oh, no, I got a better one. Hang on. This is the one we need to do.
Hey, Dr. Steve.
Yeah.
My name's Fred.
Hey, Fred. How goes it, man?
I might have sex with somebody who has, a female that has herpes.
You don't have to specify that.
I know I'm not going to have intercourse, penetration between our bodies, but will I catch anything if I just use my fingers on her?
Okay, do you know the answer to this, Tace?
No, I do not.
It was a thing that GVAC could never remember the name of. And yes, you can get, and you'll see this in healthcare workers sometimes, they will get herpes of the nail bed, and it's called herpetic Whitlow. So yeah, you absolutely can. So, and just because they're not actively having symptoms doesn't mean they're not shedding. So there are some things that you can do. Number one, if you're not going to have penetrative intercourse, then you can just, you could wear rubber gloves if you wanted to.
Yeah.
If you're just going to manipulate them, or you could have them, use a toy or something like that. That person, if they have frequent episodes, could be on suppressive therapy. They could take an antiviral every day. Doesn't 100% prevent transmission, but it reduces the risk significantly. And there are couples out there where one of the people has herpes and the other one doesn't, and they've never gotten it. Now, that could be either from they're lucky, or the person who has herpes has been really good at taking their medication, suppressing their outbreaks and recognizing them when they happen and not having intercourse. Or it could be that their partner has natural immunity. There are people who have herpes cold sores that we feel have some natural immunity from getting herpes genitalia, in their genitals, because they already have antibodies to herpes that are protective. So it's always very interesting. So if you're going to be in a monogamous relationship with this person for the rest of your life, call us back. We can talk about things that you can do as a couple to prevent transmission. Anyway, so let's check out what's going on in the fluid family. Myrtle Manus gifted 20 weird, I almost said bedabbler memberships, 20 Weird Medicine with Dr. Steve memberships. A lot of people got their memberships, so don't forget to go to our channel at youtube.com/@weirdmedicine and click join and then click accept gifted memberships, and people will give out memberships from time to time. Let's see here. And then, Nick Illig, thanks for the $5 super chat. Said, you mentioned low glycemic diets help reverse type 2 diabetes, but not low carb. Any known reason for that? No, I didn't mean that. Low carb diet, absolutely, it's better. I think I've cured people of their type 2 diabetes by getting them to adhere to a low carb diet. I think what I was saying was it's hard for a lot of people to adhere to, and the low glycemic index diet can be beneficial for people with type 2 diabetes. But I'm not 100% sure what the record is on curing people of their diabetes by using that. Now, this is not type 1 diabetes. These are for people who have insulin resistance. So, and when I'm talking about low carbohydrate diet, I'm not talking about that meat diet where you just eat meat and bacon and mayonnaise and cheese all the time. What I'm talking about is because that's the telephone game, right? Someone read the book by Dr. Adkins and told somebody who told somebody. The next thing you know, people are just eating steak and mayonnaise and cheese and bacon every day. So, the kind of, I think the healthier low-carb diet is still a carnivore type diet, but it's lean animal protein. I mean, animal fat is not the enemy, but still lean animal protein. So you're controlling which fats you're taking in. And then having good fats, monounsaturated fats like olive oil, those kinds of things. And then green leafy vegetables that are low carbohydrate vegetables, unlike potatoes and corn and yams and stuff like that. Now, a low glycemic index diet just is not metabolized to sugar as quickly, so you don't get those spikes in your insulin. And that is a diet that is all of the above I just mentioned, but also includes brown bread instead of white bread, brown pasta instead of white pasta, brown rice instead of white rice, and sweet potatoes instead of potatoes. And listen, if you learn how to properly make sweet potato fries so that they're crispy on the outside and normal on the inside, they're really good. They're tasty. I just don't like soggy sweet potato fries. So there is a way to do it. We can talk about that someday. But that's what that was about, Nick. And please say hello to your brother, Captain Mike, if you want to be in the Charleston area and go fishing with the best captain out there. Look for Captain Mike Illig. This is Nick's brother. And he's in the Awendaw to, I guess, Pawleys Island sort of area, and just go to avidangling.com, or you can find him on Facebook, Avid Angling. Really good guy. He's known my kids since they were little. I mean, Liam is a senior in college now. I think the first time we went out fishing with Captain Mike, Liam was 4 and Beck was 3. So, he's a naturalist. He knows where all the fish are. And even we've been out with him twice where we didn't catch anything. And the second time, we still caught stuff because we went in to the marina where there's a bunch of reds that, not communists, but redfish, and that hang out there. And so we caught a few of those so we could take some pictures and just throw them back. But anyway, Cap Mike's awesome. Let's see if we got anything else here that I need to announce. A lot of questions in the fluid family, but I can't read them because they're too far away. So, but check us out. Let me see. I see Amy is there. Talk like a hick to you. Says, I hate hearing my voice. Also, they drag me over there. My accent, hence my name. Well, you ain't got one like me, I'll tell you that. When I grew up in the mountains of North Carolina, that's how I sounded. And I had to go to broadcast school at the University of North Carolina for them to erase most of my accent. Not all. I mean, most people, if I go to Vermont, they know I'm from the South. But I don't have that Appalachian accent, the deep Appalachian accent anymore. And they did that without my consent, by the way. I wonder if I could sue them for that, for, culturally, not a cultural appropriation, but what would it be when they destroyed part of my my image, my self-image by taking away my Southern accent without my consent? How did they do that? We talked briefly about that. I don't know if I've ever told this story on the show, but It was Speech 101. I was a radio, television, motion pictures major. And in Speech 101, with my absolute favorite professor, his name was Earl Wynn. He was a real character, a brilliant actor, and I just loved him. And he and a guy named Paul Nickel. Paul Nickel used to do Playhouse 90. That's how old I am. And he did Playhouse 90. He did live black and white television back when there wasn't any other kind of drama on TV. And those two guys were just such great mentors. Well, anyway, Dr. Wynn would have us read the International Phonetic Alphabet, which has lots of different symbols for every sound that the human voice can make, including there is a character which is an apostrophe for the glottal stop. So like if you're going to do some sort of northern UK accent, you say bottle instead of bottle. Bottle. There's a way that you could write that out. So you could write out any accent that the human voice can make, and you learn all these symbols, and you have to learn them so that you read them just like you read English or whatever language that you're proficient in without thinking about it. And that was first semester, was just learning the alphabet and learning what the sounds were and transcribing them. When he would say the sounds, you'd have to write them down, all this stuff. So that was semester number 1. And then semester number 2, you read script after script after script. We thought that we were reading like camera tests. They'd have the camera out there, and you would read these scripts, and we thought we were pretending or practicing to read the news. But what we were doing was we were reading scripts in neutral English and International Phonetic Alphabet, and by the end of the semester, your accent was gone for the most part. So Dan Rather did this class at some point, from what I understand. Charles Kuralt was from University of North Carolina. I know he went through that class because you would never have known. He had a real soft sort of accent, listen to the birds as they go. It wasn't a heavy accent at all. But I didn't realize until later what was going on. And that's what it was, because I always said, I went to broadcast school, so I don't have my accent. I didn't really think about how it really happened until years later. And I remember thinking to myself, they didn't tell me that that's what they were doing when they did that. It just happened. And I'm not irritated. In retrospect, I'm glad that I have the voice and the accent that I have now. But because I think more people will take me seriously this way than if I'm, talking like I normally talk. I think, but always let your adversaries underestimate you too, So if you have an IQ of 165 and you're talking like this, people are going to think you're a dumbass, and you can actually get over on them because they're not expecting you to be smart. But anyway, like Tacie DeLoach, he sounds like an idiot, and he's not. He's actually a pretty smart guy. He does stupid things, but his intellect is there. He's a very smart person. So. Anyway, all right. Yep. And Stacy says, I did not see any medical questions. Thank you, Stacy. So, all right. I'm going to get out of here. Thanks, everybody. Thank you, Tacie. And thanks to everyone who has made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m., Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Hey, I'm Nolan Sykes, a host of Past Gas, the #1 automotive podcast in the world. Every week, my co-hosts, James Pumphrey, Joe Weber, and I bring you some of our favorite stories from the hallowed halls of car history. From Bertha Benz to Enzo Ferrari to Mario Andretti and his purple underpants, we cover it all. Join us as we take a look at the wild stories and larger-than-life characters behind legendary cars and car makers. So if you love cars or just like a good story, check out Past Gas by Donut Media, the #1 automotive podcast in the world.